I am Dr. Tina Teddy. I am an associate investigator here at TRI, an adult endocrinologist by training, and my research is in chronic kidney disease. Chronic kidney disease is defined as a progressive decline in kidney function. So the risk for CKD does certainly exist in type 1 diabetes. 1 in 3 individuals with type 1 diabetes can get chronic kidney disease. It has such widespread impact. For example, just generalized health, for example. It adds to the burden of the pills that one has to take, financial burden as well. And not to mention that chronic kidney disease puts them at a higher risk for cardiovascular disease itself as well. Since the 1990s, we haven't had any trials that have shown renoprotective therapies, and that is a time in the late 1980s when trials were done with what we call ACE inhibitors and then subsequently ARBs as well. And these fall into the category of RAS blockade, and these were shown to be effective for decreasing protein in the urine, preserving kidney function, and also for decreasing the cardiovascular events and mortality in type 1 diabetes with kidney disease. So at the moment, those are the FDA-approved therapies that we have. It is an absolutely exciting time because there are now new therapies that are being studied for treatment of chronic kidney disease and type 1 diabetes. We recently had positive results from a study called FIND-1 that studied a drug called finerenone, which is a mineralocorticoid antagonist, and looked at its effect on kidney function in those with type 1 diabetes and kidney disease. The next class of drugs that is being studied is SGLT inhibitors. There's a drug class called SGLT2 inhibitors, and then there's a dual SGLT inhibitor, meaning it inhibits SGLT1 and 2 receptors both. However, in this trial, we will be also studying risk mitigation strategies, meaning how can one prevent from someone using sotagliflozin for having DKA or diabetic ketoacidosis. Another class of drugs that we know very well is the GLP-1 receptor agonist, and one such drug is semaglutide, which I'm sure you must have heard about. And this has shown positive results in those with type 2 diabetes and kidney disease. And the exciting news is that it is currently being studied in those with type 1 diabetes and kidney disease as well, to see, do we see benefits in those with type 1 diabetes and kidney disease with use of semaglutide. I am absolutely excited about the upcoming research in kidney disease over the next few years.